everybody, Dr. Alfie here, and welcome back to another episode of Meet the Penis. And let me start with a question. For the last 20 years, women have had aesthetic procedures like botox and lip filler, breast augmentations, the Brazilian butt lift or the BBL. So naturally, men are starting to ask, what's the equivalent procedure for us? And believe it or not, in modern men's health, one of the fastest growing answers is penile girth enhancement using hyaluronic acid filler. Some people jokingly call it the male BBL. Now that's not a medical term, but it does capture something important. Men are starting to think about confidence and aesthetics in the same way women have for years, a true cultural shift. For a long time, men didn't talk about these things, but today men invest in hair restoration, hormone optimization, peptides, body composition, skincare, even facial fillers. So the question becomes, if we're optimizing everything else about our health and confidence, why would sexual confidence be off limits? And at Pareto Clinic, home of the Urofil technique, we're seeing patients from all over the world asking about penile girth enhancement. And what's interesting is most of them aren't chasing unrealistic goals. They just want to feel comfortable and confident in their own body. Now here's something that surprises a lot of people. When men think about size, they almost always think about length. When we talk about function and sensation, girth is often the more meaningful metric. Let me give you a simple analogy. Imagine shaking someone's hand with a long, skinny handshake versus a firm, full handshake like my father-in-law Mike would like. All right, which one feels more substantial? It's the same concept in intimacy. Circumference creates more contact and pressure, which can change sensation for both partners. So when we talk about enhancement today, we're usually talking about girth and not length. So how does this work? We use hyaluronic acid, the same material used in facial fillers and lip augmentation. It's a substance that already exists naturally in the body. It's about 5% of your skin. With the Urofil technique, we place that filler beneath the skin of the penis to increase circumference in a controlled way. Slow and steady wins the race. Think of it like sculpting, not inflating or stretching. It's sculpting. The goal is smooth, natural appearing enhancement, not something exaggerated or unnatural. One analogy I use with patients is this. You're commissioning a work of art, the one penis you have. And the penis is an incredibly dynamic organ. It expands, contracts, it changes with the temperature, it changes with blood flow. So our jobs as urologists is to respect that biology while carefully shaping the tissue. That's why proper training, anatomy knowledge matters so much. This is not something that should ever be treated like a quick cosmetic injection. Now here's the interesting part. When patients come back for follow-up visits, they rarely talk about size. They talk about the confidence in intimacy, the confidence with their partner, confidence how they feel about their own body. Confidence is powerful. It changes posture, it changes communication, it changes how you show up in relationships in a big way. So when people ask me, is penis filler the male version of the BBL? I say this. It represents the same cultural shift that we're seeing every day, and men deserve it too. So men are starting to take ownership of their health, their appearance, and their confidence. But the key difference is this. These procedures should always be done by a physician who understands sexual medicine and penile anatomy. So make sure you do your research. Who's injecting you, what substance, any research, anything. Because you only have one penis. And when done correctly, the goal is simple. Natural results, improved confidence, safety, and better conversations about men's health. So if you want to learn more about penile girth enhancement or the Urofil technique, visit us at urofil.com or at ParetoClinic.com, and we're here in Coral Gables, Florida. And if you like conversations like this, where we separate internet myths from real medicine, stick around, because here on Meet the Penis, we talk about the things most people are thinking, but nobody else is explaining. Until next time, I'm Dr. Alfie. See you later.